PHN sees that there's a great opportunity to work with allied health to support them in their practices, to increase their efficiencies and their patient-facing time. The PHN is supporting allied health practices in the region to build their digital capabilities because we know in comparison to general practice, on average, the allied health maturity is lower than general practice. And it's really important in a connected system that everybody has the digital capabilities to have safe patient care. Cybersecurity is a good example, so always making sure that you're staying ahead of the game in collecting and storing patient information. It can also include aspects such as your online presence as a business, and then using data to inform your business and your patient care. The Digital Essentials project for allied health that we're running will really focus on building up some resources and a model for digital support for allied health practices in the Hunter New England Central Coast region. And part of that is about both developing tailored resources, because there's limited resources that are really specific for allied health practices to implement digital change within their practice. So there'll be two elements. The self-service model will include support, including the digital change manager, the digital health team at the PHN, and there'll also be education and drop-in sessions available throughout the period of time for change. There'll be some resources that practices will have access to. So firstly, the checklist that they will be able to work through based off their digital maturity currently, and then look at what they want to change. And then some resources supporting that change will be the PHN Digital Support Toolbox, and that has a range of different resources that are really targeted based off the needs that the practice has identified in that checklist. So the partnership model will involve allied health practices being selected who completed the digital health maturity assessment in 2023. By invitation, those practices will be selected, and then they'll have the opportunity to work with a change management specialist. They'll come into the practice for about 4 hours to really do a deep dive into the current situation of where your practice is with digital maturity. You'll then develop, in partnership with the change management specialist, an action plan to take forward. You'll have access to one-on-one support to create that change and to implement that action plan. You'll have access to templates and resources to manage the change, and then there'll also be the opportunity to work with other allied health practices in a bit of a peer-to-peer model. It's important for allied health practices to increase use of digital tools that are best practice to meet compliance and regulations around patient safety. But it can also help to improve practices' business efficiencies, which has greater gains both for the practices and the wider community, because allied health practices are providing high quality care that is safe and accessible. So the expression of interest for the Digital Essentials project for allied health will open on the 14th of August. For the self-service model, which is open to all practices in the region, there will be an onboarding process in October, and the project will run through to March. For the partnership model, that will be directly sent to practices that are eligible to apply. Any allied health practice within the Hunter New England Central Coast region can participate in this Digital Essentials project. So if you're interested, please contact the allied health team at the PHN.